Well, new tonight, federal officials approving the nation's first over-the-counter birth control pill. The landmark decision will soon allow women and girls to quickly get birth control without seeing a doctor first. Our Zaria Oates with just how big of a change this will bring to the Mid-South, especially now that abortion is illegal in this part of the country. Zaria?
Richard, the daily birth control pill, O-Pill, can now be sold legally over the counter at drugstores. There are still plenty of questions surrounding exactly what this means, but with about half of U.S. pregnancies being unintended, the more feasible access to birth control could cut that number down.
Dr. John Schorge, chair of OBGYN at UT Health Science Center, says it's been a long time coming. The milestone decision coming into play Thursday morning, now making it more accessible for the uninsured.
People that are most at risk for unintended pregnancy are the ones that do not have access to oral contraceptives or contraceptives in general.
Highlighting the inequities in getting birth control.
If you just go to CVS and get a Tylenol, that you don't have to get a doctor's visit, wait in line, take transportation, time off work, find people to watch the kids. It simplifies everything, and it's going to be a great advance for the women of Shelby County, especially the uninsured, the underinsured, the underrepresented minority women who are most at risk. It's going to help all of that.
O-Pill does have side effects, including irregular bleeding, headaches, dizziness, nausea, increased appetite, abdominal pain, cramps, and bloating. But Dr. Schorge said these are clear side effects associated with most forms of contraception. However, something that's not clear yet is age. What's the starting age for someone to buy this form of contraception? Technically, many over-the-counter medications don't have an age requirement. With the ruling by the FDA being so new, it's not certain if an age requirement will be made. Regardless, he insists the pill does more good than bad at most ages.
And I would tell parents that there's a tremendous safety profile of oral contraceptives. They prevent ovarian cancer, they prevent uterine cancer, they have a number of other health benefits in regulating periods, there's really very little side effect or toxicity to really be concerned about.
The accessibility is reassuring. The unknown price point is a concern. The price still needs to be affordable, especially with a major target audience being the uninsured.
With multiple questions still lingering, the company has time to get things in order as they don't plan to ship the pill until 2024. It's also important to note O-Pill is not an emergency contraception and does not protect against HIV, AIDS, or any other sexually transmitted disease. For more on the newly approved over-the-counter contraceptive, head over to our website at abc24.com/now.